Before I had the Nalu system, I was in lots of pain. So it would really limit me as to what I could do. Sometimes I would cry all day or go to bed and cry, keep my husband up, because I love working in the garden in my yard. I had a lot of beautiful plants and flowers, and I love all of that. I love my grandbabies, and when it puts a stop to all of that, yeah, that's not real good.
Before I got this done, my kids wouldn't call me because I was nasty on the phone. I was starting to sell or send things to them that I thought was worth money. And they're like, why are you doing this? And I said, don't ask questions, just take it. And I said, it's your inheritance from me. And they go, you're talking like you're already dead. And I thought, God, if they only knew how close I was.
Our practice has specialized in interventional pain for over 20 years. We bring over 20 providers to serve the greater Tucson area as well as Santan Valley. We've recently incorporated a groundbreaking technology called Nalu into our practice. We've seen such an improvement in patients' qualities of lives, reduction in disability scores, improvement in pain scores to a degree that we've never seen before incorporating this technology. In addition to this truly has changed the way that we treat chronic pain at our practice. Prior to incorporating the Nalu, there were many subset of patients that we just didn't have a long-term treatment option for. Those patients were shoulder pain, knee pain, certain pathologies of the spine, and pathologies outside of the spine. We call that peripherally. If it wasn't for Nalu, these patients would have been without any potential interventions to be able to improve their quality of life, their functionality would have reduced, and their disability scores would have increased. Since incorporating the Nalu technology, I've utilized this for many pathologies, and I'm still taken away by some of the results that we've seen. For shoulder pain, again, seeing my patient with severe bone-on-bone arthritis who can't feed themselves or dress themselves, and now being able to do those things in their mid-80s and 90s, that's pretty much priceless.
I had a foot surgery, 3 bones fused. Since then, it's progressively just the pain is starting to get worse and worse. I've tried a couple different therapies. So far, I really haven't had a whole lot of success. Thought we would try the Nalu. It helped considerably. We enjoy life a lot more.
Well, I'll tell you what, I had gone into assisted living, and then I went and had it in, and I didn't need assisted living anymore.
Having the Nalu system is real good. There's times that I won't use it for 2 or 3 days because it has helped me so much.
It just becomes a part of you, and it's not bulky. It's not hard to live with at all. You forget it's there because you're not in pain.
I've had my back pain most of my life, but it's gotten worse as I've gotten older. Last year, before I had the implant, I was actually using a cane, and if I hadn't had it, I think I would be in a wheelchair by now.
My life has completely changed. I'm not miserable. I'm happy as can be, whereas before I was just down in the dumps all the time. I just really didn't feel like my life was worth living. And it wasn't. It wasn't until now.
Once the patient and physician decide that this is the treatment of choice to move forward with a Nalu device, the nice thing is that the first step is something called a trial run. So the patient actually gets to test drive it for a week and see how they do. At the day 7 mark, we bring the patient back to the clinic, we remove those leads and go through how they did during that trial run. So if they improve by over 50% relief, then we move forward with something called the implant component. The permanent implant of the Nalu system is very similar to the trial. The difference is everything goes underneath the skin. There's no tape, to the skin at all for batteries. So the manner in which this system is controlled is by an external battery, an outside battery. We call that a therapy disc, and that therapy disc is placed upon the skin by an adhesive. So the nice thing is that the patient actually gets to put it on and off when that pain is present, when it's at its peak.
Having this put in is a lifesaver, and it should be for anybody that's in chronic pain. I would actually say to anybody that is thinking about getting something like this to help them out with pain, if they don't do it, they'll never know. They'll stay as they were before, and I don't want to be like that ever again.
The difference between having the pain all the time and having relief is, it's wonderful. It changes your mood, because when you're in pain, you're not a happy person. When the relief is there, it's like, oh, yes, you're able to live instead of exist.
Dr. Cornelius is amazing. He's a blessing. He's a great doctor. Him and the whole staff is really wonderful. They are.